So I'd like to say welcome to everyone who has joined today. I'm Jeanette Williams and Head of Staff Experience Interim. And today we have lots of our team here today. We have Fiona Rodden, Head of Talent. We also have Ali Jennings joining us, Head of Lifelong Leadership and Learning, and the rest of our team, Mark and Carol and Ellie. So we do have a packed 60 minutes, but while we'll have others joining us, we're just going to we'll get ready to share a mindfulness video where that will help us in the next 10 minutes. We'll just have 10 minutes of it, and that will help us to ground ourselves before we move into the next phase. In the next phase, I'll pull the slides up, but we do have some colleagues that will be joining us around the Wingman project, and Fee will be hosting that segment, and then I will follow and at the end with some national and regional updates, and we'll send the information out at the end. Mark, are you ready to share the mindfulness? Okay, over to you.
The spirit to find more joy and freedom in their lives. So I'm hoping I can help you just in the next few minutes to find a little bit of that connection with your heart and feel a little bit more ease and freedom. So I invite you to put down anything you're holding on to, any devices, lunch, a coffee mug, whatever it might be, to allow yourself to just become comfortable for a few minutes as I take you through connecting with something which I hope will make you feel less stressed and decrease anxiety or any negative emotions and help boost the positive emotions within you. And hopefully you'll realize it's something really simple that you can do for yourself at any point where you feel you need that boost. So we're going to be focusing on gratitude in a particular way of noticing the effect it has on your physiology today for you to experience. So if you'd like to get yourself comfortable, maybe uncross anything that's crossed, whether you've got your legs crossed or maybe even your fingers crossed, I don't know. And just allow yourself to kind of arrive. Let go of anything that's on your to-do list just for this 5-10 minutes. It'll still be there at the end, but you can put it down for now. Just let the information, the thoughts in your brain settle for a bit. And feel yourself sitting on whatever you're sitting on, a chair or a stool, sofa maybe, wherever you are. And just allow your weight to be supported as you sit here focusing on you. Bringing any parts of yourself that have been rushing around this morning, doing other things, to just become here now, so you're fully present. And if there are any sounds in your environment, just allow them to be here with you now. Nothing you need do. They're just a part of reflecting this cycle of life that goes on around us all the time. And I'd like you to take 3 deep breaths in through your nose and out through your mouth. Really inhaling deeply through your nose in your own time and exhaling all the way out, releasing the stale air at the bottom of your lungs. Replenishing that air in your lungs and exhaling all the way out. This exchange of air, this oxygen brought to us by the plants and leaves of nature. And as we exhale, the carbon dioxide we release in turn fuels those same plants and leaves of nature. We've got this beautiful cycle, always in connection with the world around us. And when you finish those deep breaths, just allow your breathing to do whatever it wants to do right now. No judgment. Maybe just being aware of your body, the rise and fall of your chest as you breathe. Maybe your breath now entering your abdomen, also rising and falling as you breathe. And just take a moment to check in with your body and notice how it's feeling right now Are there any areas of tension? Are there any other sensations in your body? If it helps to adjust the way you sit, feel free to make yourself comfortable as you can be. But if there's sensations that don't respond to that sort of movement, try to just be aware of them, to not judge them, but to just notice where they are and what the sensation is that you connect with as you pay attention to them. It's bringing your awareness into your body. And in a moment, I'm going to ask you to switch your attention to something that you feel thankful for. It could be something that's with you right now. It could be something that's happened over this whole COVID time. It could be something that even happened many years ago. It could be a person, an object, a task, a thing, something in your life that you feel grateful for. And some days it's easy to connect with things we feel grateful for. Maybe it's the support of this group. Other days it can feel harder, in which case we might just be grateful for something really simple, like the hot drink or lunch we're about to eat, or for actually being able to wake up this morning. So whatever feels good for you now, find something that you feel thankful or grateful for in your life. And I'd like you to spend a few moments just focusing on it. This thing, this being, whatever it might be that you're grateful for. Just pay attention to what it is. Connect with having this in your life. Maybe you can picture it or feel what it's like to have this in your life. Really spend a few moments treasuring this gratitude, focusing on it. If you have several things to choose from, you can focus on just one for now. You can come back to the others at any other time. So really paying attention to this aspect of your life that you're grateful for. And as you do, just start to notice what happens in your body. Maybe your posture has shifted a little as you focus on what you're grateful for, thankful for. Maybe your breathing has shifted in some way, become a little deeper or a little slower. Maybe there are some sensations in your body that are shifting. Maybe a sense of release or opening or expansion. Just notice what happens in your body as you focus on this aspect of your life that's unique for you. Just becoming aware of this sensation growing within you. The feelings that you feel. And maybe you'd like to pick another thing to be grateful for right now. And just focus on that for a few moments. And to notice as you do, as you focus on this other aspect of your life that you're thankful for, does your body respond in the same way? Do you get more of the same sensation and response in your body, or is there a subtle difference? Just noticing, nothing you need do with it, but noticing how you respond. And in a moment, I'm going to bring you back into the present. You might just have one last reconnection with this feeling of gratitude. And then come back into your body in the present, being aware of the stool or the chair, whatever you're sitting on, supporting your weight. Your breathing, however it is right now, without judgment. And feeling yourself here and present. You may want to open your eyes if you had them closed. And you don't need to shake off these feelings in your body if they're there. They're fantastic for reducing stress and anxiety. And if before bed you take some time to journal or write down the things you're grateful for, several studies show how you will sleep quicker, deeper, and longer, which all go to supporting your well-being and your health at this time. So thank you.
This is... Sorry, go ahead, Fee.
Jeanette, I think that was me on the recording, not me really.
Okay, I just realized that. Thank you, Fee. So welcome everyone into the space. I know some of you would have slipped in during our first session. I'm always almost afraid to speak after those sessions, but it just gives us a sense of grounding and a time to begin to focus in on the rest of the agenda. So I'll wait, Mark, I'll wait for you to stop sharing. And
stopped already, Jeanette.
Right, okay, I'm just trying to share my slide. Okay. Mark, can you just share the slide? For some reason I can't, while I'm just welcoming everybody. The slides I sent you this morning.
I've got them up, just bear with me.
So just give everyone an overview. So do give us feedback in the chat box as well if you think these sessions are useful. Thank you, Mark. If you just put it on slideshow. And so we have a really full agenda for you today. We welcome everyone. If for some reason there's any sound issues or any issues at all, please unmute or raise your hand or put it in the chat box. But as you can see from the agenda, we did the guided mindfulness exercise, and now we're going to have an interactive session on Wingman project, which Fiona Rudden, Mark, next slide, please, will take us through. And we have some really special guests on today, and I will leave Fee to introduce and to take it from here. Fee, do you need these slides up at the moment, or should we take them down?
No, take them down if that's okay.
Thank you. Thank you, Mark. You can take them down. So there you go. The Wingman session is about to begin. Okay.
Lovely. Thanks so much. And I'm really thrilled that we're joined today by two fantastic people from Project Wingman, Kerry Edwards and Emma Gauntlet, who are just going to talk to us a little bit about, what it is, how it's been experienced, some of the realities of it, and maybe some of the challenges. While, first of all, to introduce it, we're going to watch just a 2-minute video that you might have seen on the news. And while that plays, if you have got access to the chat box, any questions that you've got about it or thoughts around, that you've been thinking about running a lounge, or that you've had any barriers or any thoughts around that, please do pop them in the chat box while we do this. Now, I'm going to just share this video, so bear with me just a moment. It's only 2 minutes. I've actually, since Kerry very kindly sent this to me as a good introduction, I found some other ones, so we can always share some other links to videos that went on to ITV and others as well. This one was on the BBC, and I'm just going to play. Oh gosh, I just think I have done that wrong. Bear with me just a second, sorry. having always been saying to people, you need to click the button when you share the audio, and I didn't do it myself. So bear with me just a second. There we go.
Our airlines are currently grounded, of course, and thousands of crew are furloughed. But many of them have been keen to do something to help those in the front line of healthcare. So they've set up Project Wingman, which sees aircrew and pilots staffing rest areas in hospitals across London and the South East to give healthcare workers a moment to relax and draw breath. Piers Hopkirk has been to see it in action in a hospital in Tunbridge Wells.
They're more used to operating at 30,000 feet. Now they're dedicated to helping those whose operations take place at ground level. This so-called first-class lounge created in the canteen at Tunbridge Wells Hospital, a place for staff who spend their days caring for others to get a bit of care themselves.
We've been dressed up in PPE, we've been feeling like we're wrapped up like plastic sausages all day, and so it is so nice to come down here to a slightly different environment, to talk to somebody different, have a different conversation, and realise that there is a world outside and that the sun's shining.
Simon Webster's come here to grab a moment's rest.
It's a fantastic resource. You know, here you are in the middle of a busy day, exhausted. It's a marvellous resource, and it really lifts the spirits.
There are nearly 5,000 volunteers from across the UK's airline industry operating in 30 different hospitals, using the skills and knowledge they get from working in their own highly pressurised environment. Frimley Park Hospital in Surrey also boasts its own airport lounge.
It's a rare opportunity for them to come and be served a cup of tea by, you know, a pilot or cabin crew and not talk about COVID for, you know, 10 minutes on their break.
For staff at Tunbridge Wells, it's a place of calm amid the coronavirus.
I think it's really important that sometimes as carers and people that work in the care profession, we don't care enough for ourselves.
They've got time to take a break, they've got time to process what they're dealing with, they've got time to relax, and this Project Wingman scheme has been fantastic in giving people that additional support.
Their planes may be grounded, but proof at least that spirits can still be lifted.
Okay, so a couple of comments have come in the chat box. Sorry, my music straight on with YouTube. Bear with me a second. But really keen to focus first on some of the kind of higher level stuff, and then we might go into what the practicalities look like on a day-to-day basis. So do keep throwing in comments in the chat box if things are occurring to you. But first of all, Carey, I was going to say, first of all, welcome and thank you for joining us. I was wondering if you wouldn't mind just sharing a little bit about, you know, in your role in coordinating the Project Wingman sites, what differences have you seen? Obviously, we've just seen a little bit of one there, but what kinds of different sites have you been running across the South East and beyond?
Good morning, everyone. Thank you very much for inviting us. It's great to be able to share our experiences with you. I think the differences are very wide-ranging, actually. We've set up lounges wherever we've been asked. Some have been very small. I mean, I joked with Fee when I spoke to her last week that they're often just sort of large broom cupboards, but they range from those to marquees, which could take up to 50 people, and anywhere in between. So we've been able to get into or set up lounges wherever needed, and we sort of try and make it work, because the major constraint that we've had over the last year has been space. So and that's been always very tricky. Most of the hospitals have are limited on spaces, either being used for therapy or their training rooms, or they're not COVID free, and so getting space has always been the major challenge. Sometimes we've been into the canteens or the restaurants, and of course then we've hit another problem, not often actually, but it has come across, where the whoever's running the canteen, the commercial company, has not been happy that there is a group of people offering free teas, coffees, and various other things. So there's been negotiations there as well, but generally they've been quite helpful.
It's interesting you use the word negotiation. When we spoke before, and I can see a chat comment as well around how you really got into the trusts. So I just wondered whether you might just share a little bit, and I don't know if Emma wants to share on this in a moment as well, about what made it successful. So how did you go about setting them up in different organisations, and what were some of the factors that made it really effective?
Okay, the way we set it up was that we contacted the trust directly, and normally were passed on to the health and wellbeing lead, or sometimes a volunteer, or sometimes even actually a member of staff who'd heard about Project Wingman from a friend of theirs in another hospital. So there were actually many points of entry. And because things were running quite fast at that time, and we started off with 2 or 3 hospitals and very rapidly grew until we ended up with 80 plus throughout the UK. So the methods of entry that were into the trust were again varied. But eventually we got in touch with somebody who got approval for the Project Wingman Lounge to be set up in the hospital. And one of the key things that certainly I found in my area was that if there was chief executive support, then a lot of the barriers tended to disappear. Things like the space, because people are often very protective of their space, and they were actually worried about if they gave it up, they'd never get it back. So we it was quite nice that occasionally the chief executive would say, look, don't worry, if you let Project Wingman have the space for a while, you will get it back eventually. So plus all of the other internal I suppose challenges that we had. So that was definitely a key part of it.
You also mentioned the chief exec there, and you'd said to me before that there were some key people, if you like, where if you got agreement from these people to run this, it was quick turnaround within a couple of days. And I just wondered whether you might just say a little bit on that.
Yes, I mean, what we identified four leads who would be very significant in terms of facilitating the implementation, and not necessarily in terms of decision making, but in terms of helping it get off the ground. Obviously, the health and wellbeing lead, the volunteer lead, because they need to negotiate things like volunteer induction and passes and so on and so forth. Facilities, because there were things required as regards the kettles and pat testing and so on and so forth, and any other security implications, and the media team as well, because at that time we were very conscious that the press might have got involved in the lounges, and having easy access to airline staff, where the airlines were in the press as being the villains of the piece in terms of making redundancies and things. So we were very cautious about press and media coverage as well. And I don't know, Emma, can I bring you in now? I don't know if you wanted to add to that as well, because Emma was in charge of an amazing job in terms of getting every single donation in the world, so going towards Project Wingman, but was also a team leader herself in the 2 or 3 lounges, so has a lot of hands-on experience on that.
Hi everybody, thank you. Hope you can hear me okay. Yes, as Kathy said, I kind of entered Project Wingman from the start as head of donations. So I guess as your...
Can't hear you, Emma. Can you get closer to your mic or something?
I apologise. I've been set up on a new laptop that I'm not that familiar with yet. Is this any better?
Keep talking. Keep going.
Okay, I'll talk for 5 minutes or a couple of minutes. If it doesn't
Yeah, that's better.
Oh, okay, brilliant. So I facilitated donations for the charity kind of from the get-go. As you and your trusts and hospitals were also receiving donations from the general public, so were we. And we have a number of companies that we work with as our founding sponsors who help us to kind of create the experience of a first class lounge. One of those, as an example, is a company called Gold Key Media. They work with publishing houses, newspapers, magazines, supplying newspapers and magazines to high-end hotels, restaurants, and kind of the travel industry. Obviously, they've been a secondary knock-on effect of COVID. So they're now working with us. So what we provide, and one of the things we provide in our lounges, is a magazine and newspaper stand, which is updated weekly, monthly with publications so that staff can roll in and roll out. Now, as COVID has developed, we've realised there is an issue here with COVID transmission. So we're in talks with Gold Key Media at the minute to see if there's a workaround for this. And one of the ideas they've come up with is a digital platform, which we can now have a poster of, or possibly a QR code in our lounges, so that NHS staff can access this digital platform and read magazines and newspapers in their free time, free of charge. The only thing we're having problems with that at the minute is just do we use the end of an email address to log in? So, for instance, at projectwingman.co.uk. But as I'm meeting more and more people in the NHS, I'm realising there's lots of endings to email addresses within the NHS. So that's one of the things we're working on at the minute. But that's kind of the new direction we're taking with that.
I just wanted, because I know you've done a lot of work around pulling together the donations and just making these things happen, and I've seen a couple of questions come up, and I know it's always a really big focus around how does it actually, you know, how do you get funding for this sort of thing, how much is paid for by the trust, and what is it that Wingman covers itself. So I just wondered if you'd kind of talk a little bit around, you know, what that experience around running the donation side of things was.
Yeah, so very early on we realized that donations, again, as I'm probably sure that you've experienced yourselves, is very dependent on the time of life that we're in. So be it the tiers, what industries are open, what industries are closed, because everyone is being affected. And what we realised, the way that we were doing things initially wasn't sustainable long term. Also, our CEO always jokes that we never wanted to leave the NHS with a legacy of diabetes. So having all this chocolate and cake being pumped into the NHS probably wasn't the best way around things. So we're now kind of working on a three-pronged approach. Number one is there are companies I work with kind of on a national level, and then I push out donations as and when they come available to me. These things are sporadic and shouldn't really be kind of relied on, so to speak. That's just when people get in contact with us and say they'd like to help. So for instance, last year at one point I had 240,000 cans of Coke donated to me, which I then pushed out across 80 hospitals. So that was interesting. The second thing is to view your Project Wingman volunteers as a workforce, not just people running a lounge for you. So lots of our volunteers, they're really, really enthusiastic. They really want to help. And that's especially exacerbated as they go through time and they build this sense of community is built within your hospital, and they get to know the doctors and nurses. So they tend to then go out themselves within your local area. So for instance, the lounge in Crawley, they have a local Facebook page called Spotted Crawley. So we're now working with them to source items that the staff may need there. We had another instance in Birmingham Hospital where, and this was in the first wave, so we're talking April, May 2020 now, where a number of staff at one of the Birmingham hospitals said that actually they just don't even have time for themselves to sort themselves out. And a number of nurses reported that they were struggling just to keep on top of kind of period supplies. So then we ended up finding and sourcing period supplies, which we then sent to the hospital, and they had like a free pickup point for their staff. So if anyone was caught short, they could just pop along and grab what they needed, and that was fantastic. And then the third aspect, or the third part of it, is that we do now have what's called a service level agreement that we ask trusts to enter into with us. It's not a formal agreement, it's just kind of more of an understanding, so we all work together well, whereby we would ask that the trust supplies, I think I put it in the chat already, but where the trust would supply the tea and coffee facilities, the basics, because again, we are a volunteering charity, not really a monetary financial charity, as well as the cleaning supplies. And then we kind of just do the legwork, so to speak, so that our volunteers can have the ability and the time and the mind space to facilitate the lounge. And it's just the kind of the supplies that we would ask for you guys, if that answers the question well enough.
Yeah, I think so. And I think that's really fantastic to hear, you know, in terms of the ongoing financial costs for the supplies to kind of feed people, if you like, it's not going to be that high. Obviously, and I've seen this come up in the chat a couple of times, one of the big barriers is the space. So just to throw into context with some of this, Ali and I are leading some of the work and looking after our people. And for anybody that is listening to this and on the call and saying, well, you know, this is all wonderful, but we just don't have the space, can you get in touch with us as soon as possible? Because we are looking at how do we support you to remove the barriers, to get a marquee in place, or to we've now got Wingman on wheels. So, you know, there's a bus there which does obviously have significant, you know, costs in running that service. So there is a cost attached to that, but it is a very quick turnaround to get that service into a site. So if there are issues around cost, please get in touch with us through the email address attached to the invite to this meeting. I was really keen because I know we've got a lot of people on the call with a bit of kind of experience having run them in organisations, and I want to go into that. But I just wanted to throw in first, we had some fantastic feedback and details around the benefits from Maidstone and Tunbridge Wells, particularly because they ran the sort of 7-day-a-week service. At the beginning, they moved to 5 days with a bit of touching in over weekends. They struggled a little bit, as Kerry kind of alluded to earlier, sometimes around the numbers and infection rates and all sorts of other issues. I know other trusts have faced this as well, but they have got them back in and they're keeping going. And what they shared, I thought was really interesting, was the unexpected benefits, a bit as Emma was saying, around using them as donation hubs and food bank collection sites, awareness days and engagement events. They distributed car permits and lateral flow testing, and actually even at one point used it as a bit of an observation area for after COVID vaccines. So when you have the space for this, yes, people will worry about getting it back, but if we are able to support in any way to get sort of these other sites up, you can also think about what other benefits there might be. People have said at Maidstone that the feedback from staff has just been overwhelming. And I know in some of the other videos we've watched, the testimonials from staff are fantastic. And they've said that, you know, it's already reflecting well in staff surveys. So just as people start to kind of throw in their comments, and I'll ask them to kind of put their hands up and unmute themselves in a moment. But Kerry and Emma, on that kind of thought around feedback, what would you say have been some of the benefits that you've seen, either expected or not expected?
Do you want to go first, Kerry?
Yeah, well, no, actually, I'm just going to, apart from the ones which were mentioned on the video, I think one of the things which has come up more than one occasion was not only has Project Wingman been, you know, brilliant for pampering, I think is the best word to describe it, the staff who actually need a break, but also was an opportunity to speak to somebody who looked similar in terms of they were in a uniform, they worked shifts, they were familiar with fatigue, they were familiar with managing difficult people, they you know, were used to emergencies and so on and so forth. So they're by no means a similar role, but there was a flavor of somebody who understood their roles, but who was not in the NHS. And I think that was a critical part, is that they could speak to somebody not in the NHS who they could offload to, but who could understand where they were coming from, because they had a similar type role. So I think that was a major benefit in terms of, and of course we did obviously anticipate this, and we had sort of escalation policies in case somebody was, you know, needed further help, and we were very clear with the volunteers that it needed to be escalated. They weren't experts or psychologists or anything like that, but they knew when to do that. Yeah. So Emma, yeah.
Yeah, so as Kerry said, we feed directly into the support that the hospitals provide for their staff. So if one of our volunteers is talking to someone who thinks perhaps needs further help, possible counselling, then we would either direct them, sometimes in person. In some of the lounges, we do live just around the corner from the in-house council teams. That's really good, so we can literally walk them around the corner. But more often than not, it's either an email or a telephone number to put them in the right direction. So that's great. I myself, just because of how my job has changed over the last year, I volunteer in Essex and then also in Surrey as well, depending on where I am. So I've been working at Broomfield Hospital in Essex, which has all the kind of standard wards and facilities hospital has. So A&E, COVID is quite a hot topic here, was in the first wave, is again now, sadly. The hardest thing that I find about being in the lounge is that you could argue possibly that the staff that need us the most are the staff we're not able to get to. So for the intensive care staff, where their shorter breaks are being taken up by the donning and doffing of the PPE, they don't just have the time to get down to us. So depending on the hospital, we're trying to do kind of delivery services instead. So we can call the ward, take a tea and coffee order, and someone can run it up, leave it outside the ward, and then it can be picked up, just so they know that we're still here and we're still thinking of them. And it gives them kind of 5 minutes to themselves just to have a cup of tea and collect their thoughts. And then I also work at Langley Green Hospital in Surrey, which is an acute mental health hospital. So not what the general public would consider supporting in terms of COVID, but actually is seeing just as much of a significant kind of effect of COVID on their services in terms of the majority of people and the increase of people needing their service.
Emma, I'm so sorry. I'm going to stop you there because I know I've primed a bunch of people to come along and share their experience of it. I just think that's both between the two of you. That was a lovely description of a service that I've seen as very agile. You've adapted, you've been responsive, and more than anything, very kind and compassionate. So thank you so much. Claire Ma, I know you're on the call and you were going to share a little bit about your experience running a Project Wingman on your site there. Do you mind popping yourself off mute and just sharing a few of your thoughts?
Hi everybody. So Kerry and I know each other quite well, and Emma's been based at our Langley Green location. So we've mainly had 3 sites during this time, but we're looking to expand to another 2 pop-up sites in Eastbourne and Hastings. We've had really good responses from our staff, really enjoying those sessions to get a break from the day-to-day role. We have set them up in sort of staff areas. So I know people have been talking about the issues with locations and things. We've got one up in Chalk Hill, which I think is quite small. So we've had to really be careful with the amount of people coming in to ensure social distancing, but to still be able to run it on quite a small scale. We've had to go back to where Kerry was talking about, and Emma was talking about the process that you go through in agreeing the sites. We've had to go back to our Millview site where we've had confirmed outbreaks of COVID, just to make sure that we are keeping Project Wingman staff, volunteers, and our staff safe with levels of PPE and cleaning down and stuff like that. So they are considerations that you need to keep revisiting, but it's an invaluable resource for the staff, and I'm working closely with Kerry to deliver some additional training for our staff. So it's the project is going beyond just the Project Wingman at the moment, which is brilliant.
Thanks so much for that, Claire. It's a really lovely summary of what's going on for you. I don't know if there are others on the call that would want to share what your experience has been. I know there are. It's been wonderful with the chat box. There's a lot of questions have come up around, and one of the things I'm really keen is a very important practical issue around social distancing. So I know in Maidstone, Tunbridge Wells, they sort of talked about these large sites being great for when you're needing to social distance. I just wondered, Claire and perhaps others, when you've had these smaller sites, how have you managed some of the social distancing elements?
I'm not sure about how others are managing it, but it's just making sure that people come through at different times of the day, and we have a maximum capacity of people that can come in. I know that's not always possible, and some people are disappointed if they can't come in if we're meets the maximum capacity for the room.
I don't know if Emma, perhaps you might want to. I know you're kind of working on site in a couple of areas. How are you finding some of that? How are staff experiencing it?
So again, it depends on the size of the hospital, the number of staff that you have in on a day. I would say that our target time, or the time that works best for us to be actually on site facilitating the hub, is between 11 a.m. to 3 p.m. because that tends to be for the smaller hospitals, especially when the majority of staff take their breaks. The larger hospitals, the shift changes, or the time at which shift change occurs, that's also a key point. In terms of issues of too many staff in a lounge, in the smaller hospitals, I've yet to see that be a problem. In the larger lounges, it can be a problem. And initially, when the Project Wingman first go in, it's very exciting, it's novel, everybody wants to go and have a look and say hello. So you do get a lot of heads popping in the door. So at the start, it can be a problem initially for the first couple of days, but then I think people do kind of settle down, and it isn't too much of a problem. I've got to be honest. The only time it's a significant problem or worth noting has been in some hospitals where the lounge has initially been placed into a thoroughfare or next to a restaurant or canteen area, where then the numbers of people coming through are significantly higher. And in those places, we have had to kind of review the policy and the location just to make sure that social distancing is being practiced. Other than that, it really actually hasn't been a problem.
Yeah. I am very conscious of time because there's obviously quite a jammed agenda with some of this, but it's a really interesting discussion. There's a lot of questions that have come through that we haven't addressed. What I would just sort of like to ask for anybody that is either thinking about switching their Project Wingman Lounge back on, but because you've had to turn it off for whatever reason and you want some support financially or otherwise in enabling some of that. If you're looking at running one for the first time, do the same thing. Email us, letting us know that you're interested. We will put in place any support that we can to enable it, and we will then put you in touch directly with Project Wingman, kind of with that support in mind. So any burning questions or comments, do please raise them in the chat box or put your hand up, and we'll try and get those through and answer them if we can. But conscious that we kind of want to move on to some of the other wonderful pieces that I know Jeanette is wanting to talk through in terms of the Guardians and allies that really do tie into this similar work about the need for people to just sit with a person and not be kind of constantly looking through resources and different things like that. So Jeanette, over to you. You're still on mute, Jeanette.
Thank you, Fee. Fee, can you just put one of our emails or a couple in the box so people are just checking in who they'll contact? Thank you. Yeah, Mark, can you, thank you, Mark. Can you enlarge the screen? Thank you. Right, thanks everyone. So we just want to give you a bit of an update. I'm just looking at the time, perhaps in the next 8 minutes, then take some feedback. You will get the slides and we are recording as well. Thank you, Mark. On to the next slide 5. I just wanted to give you a bit of a background in terms of the national and regional update. So the NHS People Plan or NHS People Promise sets out some national policy ambitions. And there's some three key ones: the Wellbeing Guardians, which we're hoping to have board members who strategically steer and hold the organization to account for the well-being of all of us, really. And also to support us as head of wellbeing leads, wellbeing directors within our organization. And I will share a little bit more about what the role is, but there's actually a launch on the 28th, and we have sent that invite out to all HRDs, human resources directors, CEOs, and our networks as well, to say it will be good to come on the 28th to hear about the launch, hear what's happening, and then we will come back and have our own regional launch. You may have heard of the Healthy Workplace Allies. That's something we will formally launch, and it's people dispersed at all levels of the organization. And in conversation with a number of you, I know we have allies already. We call them champions, or we have different names for them. But again, the allies role will become even more key as well. And then there's the wellbeing conversations, and managers and those with similar caring responsibilities responsibility for NHS people to actively engage in ongoing dialogue with employees to support well-being. And what we're looking at is not something that will happen in appraisals. And we know that a number of organizations have already started it, but it's not rolled out across the region. And again, we tested some information with a number of you in December, and we will have an official rollout. If we skip to the next slide, Mark, thank you. So Wellbeing Guardian,
can I just throw in, because there's a few people messaging to say we're not getting the slides changing at all. We're still on slide 3. Mark, are you there? Can you move on the slides?
Sorry.
Yeah, it was moved on. I'm not really sure.
We're not seeing it.
Right. I think it stayed on 3 for me.
Okay,
yeah,
I'll try instead. Let me try and change how I'm sharing.
Just slideshow, yeah.
It was on slideshow, but for some reason you weren't getting that, so I'm going to try sharing in a different way.
Thank you, Fee, for pointing that out. Yep,
it's all right.
Is that okay?
That's great. So if you go to that's perfect. Slide 5.
I have page 5 in my footnotes down at the bottom.
Okay, so if we move to what is a Wellbeing Guardian.
Right.
Thank you so much. Right. So basically the NHS Staff and Learners Mental Health Review in 2019 launched by the Secretary of State to have some uniformity at board level. So obviously I'm going to let you to read the rest of it, but there is a vision for the role. And on the launch, they will talk nationally about the role, the support, if training is needed, and also the resources we will receive in our region and in our organizations to support this role. So this role may be a non-exec director, or it may be an HRD director. It's not prescriptive, but it needs to be someone at a senior level in the ICS, in all our provider organizations, our CCG, our NHSI as well, and all our arm's length bodies to have that representative. Because we do realize while we need all the basics, the accommodation, the food, and everything that we need to go back to during COVID, we also need that senior level support to move health and well-being and staff experience to a greater level. So there is a vision. Next slide, please, Mark.
Can I throw something in, Jeanette, while you're there?
Yes,
please, as it relates to the Wingman thing? Now, the conversations that Jeanette and I have been having, and Ali as well, outside of this, is also around, how do we use this role as a bit of an enabler for you leading the health and wellbeing work to put in place the work that you know needs to happen for your staff where you don't already have that chief exec or board support. So, we're looking at how do we set in place levers for any financial support that we can offer to get these things in place, whereby these sorts of things are tied into that. So, that you need to have a wellbeing guardian already in place, and you would need the sign up for X kind of program. So do think about that when you're looking at how you want to implement your work and how you need board support to enable some of it where you don't already have that.
Absolutely. And that's absolutely what the role is about. And then you will have, obviously, the allies, your health and well-being leads to support, and obviously your line managers or people that are looking after people. Next slide, please, Mark. Thank you. So that's it around the ally role. Again, when we send the slides out, you will see the invite. So the invite, the launch nationally is happening on the 28th. It is to further help and shape what the health and well-being guardian would look like, the support that will be on offer for us to go back into our organizations, and what we can do collectively as a region to ensure this. So some of the work we will do with you after the launch in February and March would be to say, okay, do you have a wellbeing guardian? How are they being supported, and what support they would need? And then we will work that from there. And the vision is by the end of March that in all our organizations, we will have a named guardian. So just moving on briefly, there's a number of key updates. The health and well-being for our NHS people is key in the people plan. And again, we just wanted to remind people that although we do have COVID and there's lots happening in the space, as much as possible, nationally, regionally, there is support as well. Mark, next slide, please. This, yes, thank you, stay on that. So just wanted to let you know about the range of wellbeing offers, and we know that there is a lot coming out and the apps are until the end of March, but also there is, I was on the national call this morning and we'll send it out, there will be more support for people that are leading people. Line managers, supervisors. It's not that people that are leading people are any more special than all of us. It's just the function and the role of their job continuously and also within the space during COVID. I'm just looking at some of your comments as well in the chat box. So in a minute, I'm just going to pause. You will get all the slides, so just give you an opportunity to feedback as well. Mark, next slide, thank you. And just to let you know, a number of your organizations are completing pulse surveys. You have completed the stockade as well. Obviously, because of COVID, we haven't had as much, but this was just to give you a bit of an overview of some of the staff feedbacks that's coming from the pulse survey as well. So generally, staff feel well supported. But obviously we know that there is still much to do, especially in the area of stress reduction as well. And that's in terms of mental health. We're focusing a lot on that. So one of the things we've done is we've been communicating with our ICS leads for wellbeing, because there is an opportunity to apply for some funding with HEE linked to wellbeing and education. So we're looking at TRIM and mental health first aid, which we know that some of your organizations do have it from conversations with you, but you may have it for 6 months or a year. And at the moment, we're looking to see how we can work collectively together to ensure that there is sustainability to support colleagues now and during and after the pandemic. Next slide, please, Mark. So how do we see all the programs evolving? So it is about continuing to listen and to take the feedback. We need to ensure again that health and well-being guardians are supported in their role and are able to champion and work collectively. There's quite a lot of matrix or cross-reference working at the moment, but there is something about equipping line managers and teams, and I know Ali and her team and Fee will be involved in that, and the links to the lifelong learning. But also we need to continue to deploy evidence-based interventions on mental health. And we do have a number of colleagues working on that in terms of the occupational health enhance in the Bob and the Hampshire Isle of Wight ICSs. So their pilots will be, they have all the funding and everything ready to go. And the main delivery part will be starting in the next few weeks. So we'll be able to get some update from Ros O'Neill and Hilary Todd, and also continuous updates from Dr. Katrina Lake around the resilience or mental health hubs. So I think I'll pause here. You will get the slides in their entirety. Thank you, Mark. You can stop sharing now. And I just want to, in the minutes that we have, just looking at the chat box, and if there's any queries, please raise your hand on mute or any reflections in this space.
Jeanette, while we wait for comments and hands, can I share a visual from the last meeting? We talked about having a really basic guide for staff on the front line and community staff and in the Project Wingman lounges for those that aren't necessarily going to get access to the stuff that you're sending out through your communications channels and emails. People said last week that it would be helpful to have the opportunity to for us to print things, because it then means you're not having to have the fight around color printing with numbers and things like that. So if that is going to be something that you would want, please can you just give us a little bit of an idea on the scale and the ask, so that we can kind of build that into some of our plans, just as a quick draft. And bearing in mind this is no way near a finished article, and one of my asks is for a critical friend to support us to develop something that's useful for you. What we're trying to put together was a very, very simple quick signpost that can be handed out to people that aren't necessarily going to be accessing a lot of resources. And primarily we were thinking about critical care and vaccination staff, but of course this is appropriate to so many. Can you give us a little bit of feedback either on the chat, by email, whatever would be useful to you in terms of that? And I would really value having a couple of volunteers to help us in developing something that's useful for people. If it's not this, then it's just letting us know. We wanted to ask, would you value having a Teams chat forum or a WhatsApp group set up for you so that you can also ask the questions? We could put some things to you to see what you're wanting, but we look like we might have some funding regionally at very quick turnaround, so it will be helpful to just to have a little bit of input to make sure that we can use that appropriately. That's it from me, Jeanette.
Thank you, Fee. Yes, so your feedback on communication mechanisms will be really, really valued. Again, you can put it in the chat box, but when we send the slides out and the information, we'll remind you. Leslie Ann, you said you can't see the poster well, but from what you see, it looks great, and happy to be involved. Yay! So we have one taker. So please, if there's anyone else that would be happy to be involved, please let us know. So it's coming in. And I know Mark and Ellie just helping us to capture the names, because we know that everybody's time is precious. Carrie, you have your hand up. Unmute.
Hi, Jeanette. Sorry, I didn't want to, I put it up just to be at the end of the line if other people had their hands up, but you came straight to me. Yeah, I just wanted to add to our little session, because when I spoke to Fee last week, it was about our constraints and our capacity. And the only thing I would like to say, in the sort of excitement of getting Project Wingman, hopefully, is that actually our main capacity is management time. If I could just, stress that. What I mean by that is that when we started Project Wingman, we only had a handful of lounges and we had a team of people to deal with that. Now we're into 80 hospitals. Well, we were into 80 hospitals, and yet the team's the same size. So actually, and there's no one, full time on Project Wingman. So our capacity as an organisation is actually management time. If everyone can bear that in mind.
Yeah, absolutely, Kerry. And I would just say to that, as I said before, I think I posted the email address in the chat box. It's the same one the invite comes out from. Halal, our project manager, is keeping an eye on any responses that will come through about this. So in the first instance, just to Kerry's point, please can you just email us at the group if you've got any interest or you want any support in making that happen, but have barriers there that you want help with, and then we will be that sort of conduit to Project Wingman, just exactly so we can get them where they need to be and not swamp them in dealing with lots of queries and emails and things like that.
Thanks, Fee.
And on that note, Emma and Kerry, thank you so much for taking the time to join us today. It was really wonderful to hear about the fantastic things that you've been doing. I know the feedback through the chat box has been how wonderful these sessions have been. The feedback I've had from people that couldn't join, and I haven't played it all in, but has been really, really positive. So thank you so much for that today.
Oh, you're welcome.
Thank you for having us.
So just want to say, I love that. Just a final thanks to everyone, because I know that everybody's time is precious and you have to get back. We have recorded the session today, so we'll try and get those out as well as the slides and some update. What we are trying to do, we have taken feedback as well. And Ali, I don't know if there's anything you want to say before we finish about the email traffic and also about just sending out resources. So we are trying to capture them in links so your inboxes are not overloaded, and we're trying to send it all in one go. So between now and Friday, we will send an email with as much as we can. So please bear with us, and I'll hand over to Ali before we finish. Ali, over to you.
Thanks. And I'm just laughing because my puppy's chosen this moment now to make some noise in the background. It's always the way, isn't it? But just to really emphasize, you know, we just want to help you. So let us know what is useful. Let us know what isn't useful. And actually having some of your support and helping co-design and build this, albeit we know how pressed you are, is really, really helpful. So always our principle is we want to be helpful, and try and help navigate through what we know are some really wonderful, well-intended offers, but by goodness, there's a lot of them.
Yes, yes. So thank you so much. So unless there's anything else, obviously some of us will be in the space for a few more minutes, but if you do need to rush off and you have other things you need to do, please feel free to be released. But if anybody else has any queries, we'll be in the space. I'll be in the space for a little while. And thanks to our entire team today and all our technical backup. Ellie, Mark, Carol, thank you so much. Fee, Ali. So everybody, there's lots of people behind the scenes as well. So thank you.